It's Diamond Whitson. I am a nursing student at Indiana State University, and this is a presentation on tobacco use amongst the adolescent. Learning objectives include state and interpret the significance of prevention of tobacco use in adolescents. Find 16 toxic ingredients in tobacco products. Identify what tobacco products use is among high school students in 2020. Assess factors associated with tobacco use in youth. Identify and implement prevention implementations for youth tobacco products use. Lastly, list and perform health behavior model. You may want to pause this video to take the pretest so that you can evaluate how much you have learned at the end of this presentation. According to the American Lung Association, 80% of adults who smoke daily smoke their first cigarette at or before the age of 18. Further, 95% of adults smoke their first cigarette by the age of 21. Out of the 2,500 children under the age of 18, over 400 of those children are predicted to be daily smokers, and half of those 400 children will die from tobacco use. Severe addiction to nicotine is associated with early use of tobacco. Adolescents who have smoked 1,000 or more cigarettes report wanting to quit, but feel incapable of doing so. What is cigarettes? There are approximately 600 ingredients in cigarettes. When burnt, cigarettes create more than 7,000 chemicals. At least 69 of these chemicals are known to cause cancer. This slide includes 16 toxic ingredients inside of cigarette smoke provided by the American Lung Association. Tobacco product use among high school students in the year 2020, according to the CDC. 23.6% of high school students use any tobacco product. 19.6% of high school students use e-cigarettes, which is electronic cigarettes. 5% of high school students smoke cigars, while 4.6% smoke cigarettes. There is a 3.1% of smokeless tobacco use within high school students, and a 2.7% use of hookah use. Heat tobacco products, which is heat, not burn products, deliver nicotine to the user by heating tobacco leaves rather than a nicotine-containing liquids like e-cigarettes do. At any rate, the heat tobacco products is used at 1.4%. And lastly, pipes tobacco is used at 0.7%. There are some factors associated with the early use of tobacco, which include social and physical environment, biological and genetic factors, mental health, personal views, lower economic status, not knowing how to say no to peer pressure, lack of support, accessibility, availability, and price of tobacco, doing poorly in school, low self-esteem, low self-image, and seeing tobacco products advertising frequently. According to the CDC, 2020, national, state, and local program activities have been shown to reduce and prevent youth tobacco product use when implicated together. Great implementations to reduce youth tobacco product use includes increasing the taxes. This would make the cost more expensive for tobacco products, and in return, there is a lower accessibility to the product. Prohibiting smoking indoors in workspaces and public places may also help reduce the risk of smoking in youth. raising the minimum age of sales for tobacco products to 21 is the most favorable in my opinion. TVs and radio commercials, posters, and other magazine messages aimed at kids and teenagers in order to counter tobacco product ads. These counter ads include teaching of the negative effects of tobacco use. Encourage tobacco-free spaces and lifestyles within schools and the community. Lower tobacco advertising and promotion, and help make tobacco products less easily available through community programs. Factors related to lower smoking levels among the youth include being a part of a religious group or tradition, racial or ethnic pride and strong racial identity, and higher academic achievements. These are all factors that increase positive self-image, self-esteem, and self-worth. Promotion of self-love may help deter the teen from the use of tobacco. Health behavior model interventions include assessing the teenager's cultural perspective on health management. According to Wang et al. 2014, the effect of a HBM-based nursing intervention was studied. Clients had significant increased score of a health belief in self-sufficiency after receiving HBM-based nursing interventions compared to control groups. The second intervention is discussing the teenager's belief about health. Study used HBM mixed race clients from a lower economic, non-suburban environment to look at a vaccine sufficiency and personal restraints on vaccine behavior, and found that vaccine sufficiency and personal restraints do not significantly predict vaccination behavior, and that the convenience of the most important factor. Avery, 2004. Next, use client-centered approaches that encourage teens and their caregivers as active versus passive learners. A synthesis of studies by Karen 2013 concluded that multiple or a teaching method adapted to client learning styles and priority concerns were effective for client outcomes. Lastly, help the teen and caregivers locate appropriate support groups and resources. In focus interviews, clients shared that they learned more about themselves and their conditions through the experience and input of others, but they were not able to relate in group settings. Hakkasan et al., 2012. At the end of these interventions, the teen perspective should have been able to be assessed, allowing the nurse, teacher, counselor, or parent to effectively teach concepts that were misunderstood. Also, all interventions need to be continued throughout the time with the teen and is admitted as learning in its ongoing process. The goal is for the teen to exhibit signs of willingness and ability to learn. Other interventions work to eliminate barriers with the teen learning and teach in a manner that the teen understands within their cultural norms, so they are willing to learn what is being taught. The American Lung Association produced a program created for teenagers between the ages of 14 and 19-year-olds who smoke and wants to stop quit smoking. This program is called Not on Tobacco, also known as the NOT program. If you or a loved one wants to quit smoking, please contact your local American Lung Association office to find out if there's any NOT programs available.